While cell therapies have generated much excitement due to their diverse and robust potential in regenerative medicine, many biotech companies have taken what could be called a reductive approach. Rather than entire cells, they're working with molecules that are a different type of immunotherapy. This class of drugs has been around for some time in the form of monoclonal antibodies for therapeutics, diagnostics, vaccines, and more from pharma giants like Amgen, Genentech, GlaxoSmithKline, Bristol-Myers Squibb, and dozens of others. Regeneron and Eli Lilly have made headlines with their monoclonal antibodies for COVID-19. More recently, in an effort to improve on the effectiveness of monoclonal antibodies, companies have explored what are grouped together as small molecules, although some are still quite large. One such class that is truly a novel approach to treating disease is called bispecific antibodies. These compounds allow binding to two or more different receptors, potentially bringing together disparate targets and effectors, either cellular or molecular. Roche, Merck, and AstraZeneca are exploring their use beyond oncology to include a wide range of applications, from autoimmune disorders to arthritis, psoriasis, and asthma. But other truly small molecules are also seeing a flood of research interest in drug development. They've been called a revolution in pharmacologic chemistry because of their many unique mechanisms of action and diverse applications. A unique small molecule class that has been dubbed the next blockbuster therapy goes after what were once thought to be undruggable targets, disease-causing proteins. Targeted protein degradation utilizes small molecules to destabilize such pathogenic proteins by tagging them for dismantling by normal intracellular processes. While virtually all major pharma companies have a stake in this class, smaller biotechs such as C4, Arvinas, and Chimera are also actively pursuing its use. Few companies have as large a presence in the small molecule therapeutic and diagnostic space as Sorrento Therapeutics. Henry G., Sorrento's president and CEO, joins us now to discuss their technology. What's your approach, a comprehensive solution, if you will, for COVID-19?
So, hey, thanks, Max. And our solution to it is detect early, treat timely. Treat timely means a different stage of the COVID-19 disease. You treat with different measures or treatment solutions. So, for example, we had the COVID-19 rapid antigen detection system called the COVID stick. And we can detect whether you have infection or not in 2 to 5 minutes. And we can excluding you are negative by waiting for up to 15 minutes. Now, with this detection, you can detect the patient from symptom 1 to 7 days. The moment you have symptom, you say, okay, you're infected. Now, what's the solution? Next step. Next step is we have a neutralizing antibody, because it's neutralizing antibody is the most effective way to treat the COVID-19 infection, because the neutralizing antibody binds to the virus and to remove them and blocking them from replicating into the cells and replicating and spreading. So we have two forms of way to administer, actually 3 ways. One way is to have IV infusion, or we call IV push, because we only require 2 to 5 minutes instead of 1 hour, 5 hours infusion. You have to be hospitalized. So it's very convenient outpatient. The other form of neutralization administration is using intranasal drops or nasal drops. So that means you can drop the things into your nose, and they block the virus into the cells on the epithelial layer in the nose, and blocking them replicating into lung tissues. And that also blocks the spreading. Mm-hmm. Another way to do that also is having a genetic material encoded plasmid DNA and inject into your muscle cells, like your muscle, have the muscle to express the neutralizing antibody in your body. We actually have government DAPA grants to support this program, and this is a very rapid measure. And for example, right now the variant is, very concerning, and like a UK variant, South Africa, and the Brazilian strain. And we have a deal with Mount Sinai, got an exclusive license for all their antibody dealing with all of the mutants. So we have a cocktail right now of 2 antibody we can put in together in the 3 different forms: IV form and intranasal form, or into a genetic encoding material into your arm in the muscle. So express all of these neutralizing antibody and blocks almost all of the variants as of known today.
So Henry, let me ask you the diagnostic part of it. How is that administered? What do you use for the diagnostic?
This is very simple. You do a nose swab, very simple. It's not deep nose swab, but rather shallow. And you put it into a lysis buffer and pull into a detecting cassette. And the things positive, negative, it shows up right away.
So, So you mentioned also then that this cocktail that you're testing that can be administered a variety of different ways. How is it that this can cover all of the different variants then?
Yes.
Since we keep hearing that the variants are very specific for the vaccines, how is it that this covers the different variants?
Because we test it. We have all of the variants, we have their protein, we have their virus, and we test it. If one of the antibody or 2 of the antibody works on it, and we right now detect a couple of antibody we can put together as a cocktail of 2 that blocks all of the virus of concern, every one of them, including original Washington strain, the UK strain, the Brazilian strain, the South African strain as of today. And then eventually virus gonna be run out of tricks. So if we discover enough antibody covers all of them, and then you can, feel safe because we have a cocktail of antibody blocks them all. Now,
and as new variants pop up, do you manufacture these new antibodies, or how do you then decide what to put into the cocktail?
Now we believe right now we have enough antibody covers all of the mutants of this moment. And if anything emergent, we just need to discover more antibody, and just to make sure the antibody does not escape in our antibody cocktail. All right. So now with this said, the next step, if you get to already infected, develop the syndrome in the mild to moderate, and this neutralizing antibody really works and on the outpatient setting so that you have the diagnostic, is infected, you have your doctor do telemedicine, give you a prescription, you potentially go to a CVS, Rite Aid. From the pharmacy, you pick up the COVID drops and the intranasal drops, or you can schedule into outpatient setting, do an IV push, and that gives you the treatment. Now, what if you already develop a little bit more severe, let's say moderate to severe, in the ICU, what happens? So we have solution 2. One is oral pill, dealing with the cytokine storms, and that is called abivertinib. It's a BTK inhibitor. And we already have about 140 patients enrolled in both US and Brazil. And we're gonna get into big time in Mexico. So this drug, if that works, gonna be potentially discharged from the hospital very quickly. And then if this gets really severe, like if people gets into ICU and they need oxygen and intubated on the ventilator, we have mesenchymal stem cells, which is derived from adipose cells, right now in human testing. And this right now, every one of the patient using this infusion, which it requires 3 infusion, every one of the patient treated discharged from the ICU. And some of them on the deathbed. After first infusion, feel much better and requires less oxygen. Second shot, they want to go home. Third shot, they immediately released from the hospital. Wow. We're talking about discharge from ICU and the discharge from hospital on the same day.
Wow. So
very impressive.
This sounds obviously very exciting. And it sounds like you have the capability to develop some of this for other viruses or even other diseases, infectious diseases, and going on to cancer?
Yes.
How else will you use this platform?
Yes, so we have a human antibody library approach. The approach does not require the recovered patient samples. For example, all the neutralizing antibody discovered from infected patient recovered without neutralizing B cells in their body. However, this is in vitro in the test tubes. It's test tubes with billions of antibody in it. So we can just screening any target. Let's say you have a nipple virus just happens right now, and we can have the sequence and putting the antigen in it. Immediately, you're gonna get, within 2 weeks, you're gonna have antibody. Now, if we do plasmid way to do it and encoded the plasmid into your muscle cells for muscle to express, we can have this response, rapid response within a month. That's where the Department of Defense, DARPA, give us the grant to aggressively, getting this one tested, validated as a rapid measurements response for any emergent pathogen. Of course, this can be used for antibody therapeutic in the oncology space. For example, we can use the plasmid DNA to express the PD-1 antibody, which is about Keytruda is selling for 15 to 20 billion, Optivo, another 12, 14 billion. You're talking about 60 billion product we can express in your muscle, let yourself express it. So that would disrupt the whole business, the industry. So we have enzyme replacement for Gaussian. Now that could be interesting too.
So how you have so many different possibilities here within the company, how do you decide what to focus on? You know, the saying that a jack of all trades is a master of none. How do you decide where to really put your energies as a company?
Yes, so we're all staged. For example, diagnostic side, we already submit the EUA. If the FDA gives us a green lights, we start in general revenue. And now we already have this neutralizing antibody in the phase 2 study, and abivertinib in phase 2, and mesenchymal stem cell in phase 2. And these are rapid clinical testing. Could be getting to a point to potentially EUA approval, all of them in this year. So that gives you a potential revenue generation. And everybody say you have a lot. We have a big pharma's portfolio. Now we have a very strong resources in the public equity as well as cash level. And now we can do quite a few programs at the same time. Now, hopefully one day we're not only jack of all trades, master of none, we could be a master of a few.
So you can chew gum and walk at the same time.
Exactly. That's
Henry G, thank you so much for your time. It sounds very exciting, and we look forward to hearing more about it.
Thank you very much, Max.